You can have what we call COPD, things that some of those diseases that change the makeup of your lungs, so that structurally you start to behave like someone with asthma. So you can have some adult onset symptoms, but for generally childhood onset, we are dealing with people who have some predisposition growing into the symptoms and then stopping at some point which we do not know. It can stop at any time. That's why parents always ask, when will I outgrow? When will it stop? We really don't know, but we hope at some point you stop. But if it doesn't, please continue to get the care.
Wow. Do you think that these cases have increased over time when you see the current trends?
I think yes and no. Why I think it's yes and no. Even when we were children, we used to see these people. I don't know if you remember, there was always that person with their little inhaler in the pocket. There were not very many.
And anytime they carry them to the sick bay.
They are there, but now also the awareness is there. Okay, not every cough is
an asthma.
Yes, but they are there. We're finding the pattern because it's mostly a clinical diagnosis. We are finding the pattern and we are more aware now.
Excellent. So now I want to talk about, of course, the environmental factors. I have passion for environmental health and nutrition in my own instincts because I believe the environment has power to control the way we are. Sometimes you have the intrinsic factor to do something right, but what the environment gives you, you bend towards it, just like germination.
Yes.
So now, we want to explore what are the environmental risk factors to a person develop this respiratory condition.
So,
especially in the urban settings.
In the urban settings.
Because where most
of us are.
Yes.
So one of the things that we are dealing with in the urban setup, they're the old houses where things are falling apart and our children are living in those places. I don't know if you've seen where the ceiling used to be wooden and now it has black things covering it. There's a cloud of mold. If someone with the predisposition is living in a house like that, they will start having symptoms. Then we'll be treating. They are coughing at night all the time. They are coming in with, every time they visit that jaja or that auntie in that house, they are coming in with the symptoms. And we think, okay, what is it? So that is one. The other thing is how we cook, the biofuels. Are we cooking with firewood? Are we cooking with gas? Are we using
charcoal?
Charcoal, are we using electricity? Especially for charcoal and firewood and even burning things around the house. Those sort of the biofuel sources give us smoke, and some of our children are living next to where the pit is being burnt. You're living next to the window where the smoke is coming from the kitchen. You're living, you're the one who is actually making the meals, and they don't know why you're always coming out of the kitchen, coughing and feeling a little bit breathless every time you make a meal. The other one is construction sites. We have places where lime is flying about, dust is flying about, roads. If you're living with the urbanization, there are roads that are being constructed everywhere almost. So all that debris coming off has potential to be a hazard for people with this kind of manifestation. If you're living in a place with seasonal plants, there is some of that pollen that can affect you. Then, of course, the cars are more in the urban setting. So you find that we have fumes everywhere. And then there is also the subtle fume that we do not know about. Our own deodorant, our own perfumes, there are people who are triggered by those things. So every time mom is getting out of the house, gives themselves that dose, and the child coughs all the way to school. They might not be wheezing, but they are coughing because there is an irritant. And then one day when they come in an attack, that's when we're like, oh, all this time. Okay? So they can be very overt things, but then there are those mundane things that we do that are also affecting children with asthma.
Okay. Thank you so much, Dr. Namli. And of course, I know viewers are enjoying this very program because this condition is common, is almost in every school, and people have seen people who live with this condition. Want now to explore the symptoms, what can be a telling factor from childhood, maybe in adolescents, maybe also in senior citizens? How can they know that, yes, they're developing this condition?
Yeah. So like we alluded a bit earlier that asthma is